to be given today's date at 0800 for Josephine Johnson, date of birth, med rec number match. I have a good expiration date, taking that for her non-insulin dependent diabetes, and I've noted that allergy. Third and final check, metformin 500 milligrams to be given BID at 0800 here on today's date, not yet been given for Josephine, date of birth and med rec number match. I have a good expiration for her, the non-insulin dependent diabetes, and I've noted that allergy. Okay, I've scanned to the bottom of my piece of paper. I have no PRN medications for the patient that I need to follow up on. So now I'm ready to go into the room. So again, on meds, be organized, be swift. A lot of times students will get too bogged down in this area. Okay, so now I'm going to re-enter the room.
Come in.
Hello, Josephine. It's Jane. Again, I'm the nurse with St. Cloud State University.
I got dozing now.
Okay, that's all right. Taking naps are okay. All right. I'm back with your 8 o'clock medications, Josephine. And before I go ahead with your medications, can I please take a glance at your name badge?
Sure.
All right. And can you please state your full name?
I'm Josephine Johnson.
All right. And medical record 987654. That matches. So what am I doing with my chart? Keeping it open till I'm done. All right, Josephine, so I'm here with your medications. I'm just going to go ahead and take a moment to get a few things situated. Are you still in a comfortable position?
Yes.
And then just to review that pain again, earlier you had mentioned you have just a little bit of low backache, about a 1 or a 2. Is that about the same?
Yeah.
So it's not any worse. Okay.
Yeah. It's just I'm stiff. I need to get a stiff.
Okay, and so we'll take care of that when I'm done here. And do you need to use the bathroom?
No.
Okay.
Unless you're giving me Lasix this morning.
No Lasix this morning.
Okay.
All right. Now, I'll just take a moment to review what we have here. So, Josephine, I've got your ferrous sulfate, and that's an iron supplement. You take that once a day. I have your erythromycin, and that's that antibiotic you take every 6 hours for your pneumonia.
Okay.
And you have just about 3 more doses left of that. I have your digoxin. That's for your congestive heart failure, atrial fibrillation. Your apical pulse this morning was 80, so we're going to proceed with giving that medication. And then last I have your metformin, that's for your diabetes. Your blood glucose this morning was 120, and so we're also going to go ahead and give that. Do you have any questions about the medications this morning?
No concerns.
No concerns? Okay. Have you had any problems swallowing, Josephine?
Just the big potassium pills.
Maybe I'll go ahead and lift your head up. And we don't have any large capsules this morning
Okay.
to take. The metformin is a little bit big. But let's go ahead and have you take a sip of water.
Okay.
Did that go down okay?
Mm-hmm.
All right. And so here are your pills. Do you want them all at once?
I'll take them all at
All
once.
at once. Okay. There you go.
All right. Thank you.
And did those go down?
Mm-hmm.
Okay. Josephine, before I proceed, I'm going to go ahead and just document everything that I gave here. So I have ferrous sulfate, erythromycin, digoxin, metformin. Scan to the bottom of my paper. I've reviewed everything. Maybe if it's helpful for you, take one step back, pause, make sure you've got everything, reapproach your charts, and check it. Top to bottom, corner to corner.
Another thing you could
Okay.
do is bring 2 pens with you. So when you open that chart, you lay that pen right on top of the
Yep.
MedRec.
Whatever process is going to work for you, but this chart does not get closed until you know you have reviewed every square inch of that paper. Fair enough? So again, I have documented everything. I've reviewed it all the way to the bottom. I do not have any PRN medications to document. So are you catching the hint here about the PRN medications? What's the hint?
Make sure there is or isn't any.
And what? If there is,
Make sure if they need to be.
you make sure that you documented it, right?
Yes.
Because for some reason we tend to have an imaginary line that we stop at. And we forget about maybe what's left on the bottom of the paper. So I have scanned that entire chart. Now I'm going to close it.
When you're in clinical, any cardiac meds or blood pressure meds, we're going to have you document what the heart rate is and the blood pressure.
Yeah.
Same thing with oral anti-diabetic or insulin. We're going to have you document the blood sugar.
Yep.
So that the staff knows that you did review, in fact, review the vitals.
Yeah. And we'll go through that next week in EPIC training, what that comment box looks like, so that you see that and the expectation that we have for documentation. All right, Josephine, I just need to complete then my head-to-toe assessment. Are you okay if I continue forward with that?
Yes.
Okay, so I'm just going to start at your head here And I'm just gonna palpate. I'm gonna note, behind your head here, any, open areas. And
Oh, that
is there
feels good.
any pain or discomfort when I touch?
No,
No, okay.
keep going.
All right. Josephine, I'm just gonna, shine a bright light in each eye. If you could
Okay.
just look, forward at me, or
Sure.
forward, to the edge of the room here.
Okay,
And pupils constrict with light, sclera is white, clear, no drainage.
good.
And now for the headed toe assessment gang, we're just gonna have you stay on one side of the bed. That will just kind of keep us moving through the test out. So you might see me reaching, that might not be the most appropriate in clinical, so you need to make that judgment. But for purpose of the test out, stay on the one side. All right, Josephine, I'm just gonna take a peek in each ear here. Any pain or discomfort at all with your ears?
No.
Okay. No drainage is noted, no redness. Just gonna shine a light in your nose.
Oh dear, my nose isn't
You
blown
could-
this morning.
Okay, well I can offer you a Kleenex.
Okay,
Okay. No drainage, and just gonna take a look in your mouth, if you can say ah. Okay, I'm just noting, no dentition, mucous membranes are pink, intact, and moist. And so again, you're just gonna verbalize findings out loud that might be consistent with that H&P that we've given you, okay? Next, Josephine, I'm just gonna go ahead and recline the bed back here to 30 degrees. Oopsie, going the wrong way. I'm just gonna shine a light, just looking at your neck veins, and no distension, jugular venous distension is noted, especially with congestive heart failure. That would be something that you're gonna wanna look at. All right, next, Josephine, I'm just gonna go ahead and assess the arms, okay? And so skin color I'm noting is natural, natural in color, or pink, however you wanna state it. Skin temp, you'll use typically the back side of your hand, so skin temp is warm, and dry. I'm gonna note capillary refill time of each extremity, and that's less than 3 seconds. For skin turgor, you can either do, based upon the age of your patient, distal to the clavicle or the top of the hand. Whatever choice you want for clinical that would be appropriate and for test out is fine. So again, I'm just gonna check for skin turgor. Skin turgor, that looks intact within defined limits this morning, Josephine, so that's a good finding. Now, Josephine, I'm just gonna assess some strength here. And so you can do this gang one of 2 ways. Josephine, can you lift up on my hands as I'm pushing
Yep.
down? And or you can have the patient push down against you or lift up like this. Another thing would be to offer 2 fingers and have simultaneously the patient squeeze your 2 fingers. Don't give 3 or 4 because what'll happen is it'll pinch, like especially if you're wearing a ring. So just offer 2, have them squeeze. So can you squeeze for me, Josephine? Or
Josephine.
yeah.
Yep.
Sorry, thank you.
Yep.
And strength is equal and consistent. The other assessment would be to assess for arm drift. That might be real appropriate on a neuro unit. And so how you'll do that in clinical is usually we have patients close their eyes and put their arms out, palms up. And if you see something like this, it would mean a deficit. So, Josephine, I'm gonna have you assess for arm drift. Put hands out, again, make it up. So a negative finding, that's just saying. All right, I've already listened to your apical pulse. So Josephine, I'm gonna go ahead and just assess your lung sounds.
And for benchmark, it's just the 3.
Trying to think if I have everything on the upper extremity. Skin breakdown,
Yep.
did strength,
Yep.
turgor, capillary zone. So for the lung sounds, what'll happen is you're gonna listen to 3 locations on the front, and then you're just gonna indicate to faculty that you would also listen to 6 locations on the back, but we're not gonna lift or turn the patient, the mannequin, to do that. In clinical, of course, yes. 3 on the front, 6 on the back. So again, I'm just gonna go ahead and listen. All right, good deep breath in and out, Josephine. And then listen. Okay. So Josephine, your lung sounds are clear. I would, again, you'll verbalize out loud that you'll listen to 6 locations on the back. So Josephine, lung sounds are clear, a little bit diminished in the lower lobes or the lower fields.
Okay.
Now how about that breathing again?
It's better, it's much better
Much better?
Yep.
Okay.
I
I'm gonna go
coughed that big plug out. Ugh.
Oh, well, coughing is good. Keep coughing and deep breathing, and then I'm gonna just check your pulse oximeter one more time, and it's 93, so that's
Ooh.
good.
I'm coming up in the world.
Up in a row. All right, next, Josephine, I'm gonna go ahead and I'm just gonna listen to your abdomen.
Okay,
And how's your appetite been?
it's improving.
Improving, good. And have you had a bowel movement?
I am starting to pass gas.
Starting to pass gas? Have you had a bowel movement? I noted in your chart you had one last evening. Anything this morning?
No, not yet.
Okay, so I'm just gonna assess for abdominal distension. I don't see any, so I'm gonna go ahead and listen. And listen, 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 and listen. And so yes, in the test out, you can move that swiftly. Okay, so Josephine, your bowel sounds are active in each quadrant. Next, I'm just gonna go ahead and palpate here.
Okay.
When I push, do you have any pain or discomfort anywhere? No? Okay, good. Now again, I noted in your chart you don't have any drains from your bladder. Are you able to get up independently to the bathroom?
Yes.
Any pain, burning, or itching when you
No.
pass your urine?
No,
No,
I'm good.
that's good. All right, next, we'll move to your lower extremities. Okay, we're saying she doesn't have a drain. I know there's one in there. If she does have a drain in the test out, what you're gonna do is just assess that it appears to be patent, meaning there's no leaking, and then you'll note the amount of urine that's in the Foley bag. We will not have you empty anything, just note the characteristics. So you'll just look at it, you know, there's 200 cc's of amber clear urine. Okay, that's how that will look, okay, or how that will sound. All right. Now, a lot of times what students find that is helpful is they'll expose both legs at the same time, kind of like this, keep patient covered. So I'm noting skin color. Skin color is natural and pink in color. Temperature is warm, dry. I'm going to go ahead and assess for pedal pulses. All right, so posterior, or dorsalis pedis rather, are both present. Posterior tibialis are both present. I'm going to note capillary refill time. Each are less than 3 seconds. I'm going to note for skin breakdowns. Now my back is going to be kind of to you. I don't note any skin breakdown. I'm going to assess for strength. So you can do, again, this one of two ways. So I'm going to push down on the feet, invite the patient to point the toes towards the chin. And likewise, I'm going to push against feet. And Josephine, can you push against my hands?
Yes. I have a heavy foot.
Heavy foot on the gas pedal.
Yes.
All right. Any pain while doing that? Any pain in your calves?
No.
Okay, so strength is equal.
For my
Sensation.
70th birthday, I got a little red sports car.
A little red sports car. Convertible?
Yes.
That
I
would
even
be
drove
fun.
it in Pasadena.
You know there's a speed limit.
Yeah,
All right.
Wisconsin just raised her.
And, well, yeah, I think in Minnesota too, right? You live on Highway 23 or wherever it is. Sensation can also be something that you'll do. And so, Josephine, which toe am I touching?
You're touching my little toe.
The little toe is correct. And now how about what toe am I touching?
Oh, you got the big piggy.
The big toe, yes, that is correct. So let me just think here. Another way to assess strength gain is to have your patient bend at the knee and to push or straighten leg against resistance. That would be another way at clinical that you can assess strength. You each will have an opportunity to shadow the RN. I don't know if everybody will get in on a head-to-toe assessment, but I want you to watch what they do for their head-to-toe assessment. Okay? So let me think. Now I just want to pause, make sure I've got everything. So temp, color, sensation, capillary refill time, pulses, skin breakdown. That's everything. All right, Josephine, that concludes my head-to-toe assessment. And I've checked my oxygen saturation. You certainly could double check the IV. That I think is a step on your sheet. You can do that while I was doing like the upper extremity assessment. All right. So Josephine, I'm finished with everything. Do you have any questions for me before I
No.
bring in breakfast? Are you still comfortable?
Yes, I am.
Okay. And do you need to use the bathroom
No.
before I go? All right. And the pain still, just once I get up in the chair, we'll assess that again.
Okay.
I've reviewed oxygen saturation level. Josephine, your call light is here if you need anything. Use my privacy